behalf of the African Population and Health Research Center, I'm really very honored to welcome you all to the part of Africa, Kampala. And we know that you bring to this room different scholarship, minds from across the continent. The energy and commitment that you bring to this room represents the very best.
So the Mental Health Data Prize Initiative is an initiative that was launched by the Wellcome in partnership with the African Population and Health Research Center. So this initiative addresses data-related tools and solutions to anxiety, depression, and psychosis, prioritized for the African continent. During the launch, we brought together teams to support capacity building or strengthening around mental health science, data science, and lived experience.
I think data science enables us to uncover insights from raw mental health data sets. And in particular, data science enables us to develop applications to collect, to integrate, to analyze, as well as do predictive modeling for mental health risks. Artificial intelligence actually helps us to uncover insights and patterns much faster than a human being can do. But also artificial intelligence needs to work hand in hand with mental health practitioners. So the human part of it needs to be part of the AI life cycle.
One of the most critical outputs of this workshop has actually been bringing together teams of mental health, data science, and lived experience expertise from across the continent to form a community of practice. And that's really powerful because it sets up the opportunity for future work and collaborations and learning from each other. Typically, mental health research has been very fragmented on the continent, so this is a really important output.
One thing we talked about is sharing the variables in our data to see which ones are similar. And maybe we can create a data set also with data from Malawi, Uganda, and South Africa for young people if we have collected data on the same variables.
Now, when we talk about open science, I think open science is very important because it encourages us to share knowledge and work collaboratively. And I do think by sharing the knowledge, making it open, making sure that methods are accessible to everyone, it democratizes knowledge and we are able to basically innovate much more quicker.
Within the teams, we are generating new knowledge around mental health and the use and utility of this data to inform better mental health outcomes. So that's the impact we envision to see at the end of this project. But also, on top of that, we have tools, we have technologies that are supported, we have ideas or frameworks that we are coming up with on how should we integrate lived experience within the research projects. And that's a big thing for us.
For the longest time, the way research has been done, especially even in the continent, has been very tokenistic when it comes to involving PLEs. And we are trying to communicate that PLEs are people, they have real experiences, they need to be compensated, their stories need to feel important in the research work itself. But on the other side, it's also to inform the researchers that PLEs are not just there to fill blanks in some papers in order to look like the research has been involving PLEs. The PLEs can also be co-partners in your research protocols from the beginning of this research work.
So this experience has been very enlightening for me, especially from the aspect of the lived experts and their input, but also the opportunity for collaboration in terms of data, in terms of data sharing, in terms of open science. So for us, it's more of an adjustment or a restructuring in a sense to align with what we have learned.
So we are looking to generate global evidence for improved mental health outcomes by looking at country level, regional and cross-country learning to inform global evidence on what it takes to improve mental health.